Morning all, welcome back to the lecture hypersensitivity, lecture 15. We have spoken yesterday a little bit more details on hypersensitivity type 1 and type 2. In this present class, we will cover type 3 and type 4. Just a recap, we have seen already that hypersensitivity reactions depending on the immune cells or response from acquired immunity, either antibody humoral mediated immunity or cell mediated immunity. They have been divided into different types. The first three are dependent on antibodies. There may be IgE in the type 1, type 2 IgG and IgM, type 3 again IgG and IgM are involved. And then type 4 is cell-mediated immunity. They involve mainly the T helper cell or T cytotoxic cells. We will see that. And depending on the response, immediate or a little bit incubation period is required. And depending on type of the molecular mechanism involved, immune cells involved, and then further examples in here. Even here, the hypersensitive reactions are divided into different types. That we already seen several times in the last few lectures. In the mnemonic, we have seen that it's ABCD. The A is the first one, fast and first. That is allergic, anaphylaxis, atopy. These are the symptoms. Response to allergen is type 1. And then type 3 is the response to immune complex. C, A, B, C, D. C is immune complex. You're not looking for one antibody, one antigen. You are looking for complexes that we will see in today's class. And type 4 is the last and it is delayed. And we will see why it is called delayed because of the duration. It takes 48 to 78 2 hours to give a response rather than it is in minutes or seconds. Allergy can give a response. And then type 2 is a classical antibody. All processes are involved. That is, it is called as the antibody B has been there. So that's what we discussed already. And coming on to type 3, again, it is antibody dependent. So you have to go into the fundamental interaction, how it happens. An effector cell, it will have FCR, FC receptor. Then FC is the molecule of, it is the constant region of the antibody, but the C doesn't refer in terms of the English language. C is not constant. But the region is a constant region of the antibody. It's a variable constant region, but the C refers to FC, crystallizable, fragment crystallizable. And this is the fragment that helps in the binding, and the antibody binding helps in pathogen binding. The first two types we discussed, first and fast, type 1. Type 2 is cytotoxic, antibody dependent, cell-mediated cytotoxicity. That's why cytotoxicity. And type 3, we are speaking in terms of as a complex here. In type 3 means there are three things together, three things together per se in terms of mnemonic, antigen, antibody, and another complement, another protein called complement is also involved. All three may form a complex. That complex, all three things together, type 3 mechanism. We'll see that. Some of the text I have provided is from this emboss. We have seen already. But for the given type 3 and type 4, I could able to find that some other relevant material in YouTube was more approachable to type 3 and type 4. So I might provide that link to you, but you can still go to this link or that link depending on your convenience. You can read the material. So coming on to type 3. The type 3 hypersensitivity reaction, it is an overreaction of the immune system that accounts for many glomerulonephritis and vasculitides. So vasculitis. So they are talking about a specific tissues or cell types in a body, human body, and they are talking that according to these glomerulonephritis, vasculitis, it's and also serum sickness and Arthur's reaction. They have seen that in these four symptoms, disease condition, they could able to see that it is a cause of fundamental cause of this disease is overreaction of the immune system. That is basically utilizing the type 3 hypersensitivity reaction in all these four cases. And they were able to see that when they delve into more detail, they came to know that it is caused by immune complex deposition. So yeah, they are talking about immune complex deposition, which leads to complement activation and release of lysosomal enzymes from neutrophils. And subsequently, it causes a cell death and inflammation. Okay, it is type 3 is in the further in this fundamental disease condition. They have seen the type 3. They came to know that it is caused by immune complex deposition. They are seeing immune complexes, either antigen, antibody as a complex, antigen, antibody, and complements as a complex. They have been deposited specifically into these canals or tubes. Glomerulonephritis, it is kidney tubes. Vasculitis, it is nothing but blood vascular systems. We'll see that. And these two are different conditions for diseases. We will see further in the examples. So type 3 again, as speaking, it is a complex. So we will stop and we will slowly go now into the video and see how he explains it. Then we will come back and look into the mechanism one more time. Okay. So we'll go to the YouTube and then share. I'm shared with the audio, I think. Yeah, shared with the computer audio. Go into that. So we are looking now type 3 hypersensitivity, and that discusses mainly immune complexes. We'll see that how it happens.
Let's discuss the mechanisms of a type 3 hypersensitivity reaction. Type 3 hypersensitivity results when antibodies bind to soluble antigens, deposit on body tissues, and cause damage through complement activation. When soluble antigens like a medication, insect venom, or animal venom enters blood circulation, IgM or IgG antibodies will detect and bind to them, forming antigen-antibody complexes, also known as immune complexes. Immune complexes attach to the endothelium of the blood vessel wall or to other tissues, like the synovium of joints, the glomeruli of kidneys, and the epithelial lining of alveoli in the lungs. The complex attached to tissues activates the complement cascade, beginning with C1, which leads to activation of proteins C5a and C3b. C5a acts as a chemotactic factor for neutrophils and attracts them to the site. Once recruited, the neutrophils utilize Fc receptors and the complement receptors to bind to the antibodies and C3b deposited in the tissues. Upon binding, the neutrophils release cytotoxic granules containing reactive oxygen species that damage the body tissues.
So let's say divide that into a little bit. So you're talking about specific one more condition in type 3 hypersensitivity. They are saying that the soluble antigen, the foreign antigens, they are coming from foreign substances such as medication or insect or animal venom. So basically you're saying that these two conditions, when antigens are coming from that, specifically type 3 hypersensitivity will be elicited. Basically the antibodies in this case, not IgE. IgE is the antibodies in type 1. Type 2 and type 3 is IgG and IgM antibodies. Specifically, these molecules will come, they will bind, and they will see that they are not individually bound. There is a complex here. There are two antibodies, three antigens here. They will form a complex here, and they go attached to the complex in terms of the endothelial cells. The lining of some of these kidney and some other alveoli of lungs. This is the linings. Endothelial cells are linings of these kind of organs. When they bind here, when they bound this point, then based on this antigen antibody complex that is bound here, it triggers a mechanism of complement cascade. So basically the complement proteins will come and they will go into hyperactive mode to give into more complement proteins. Based on these receptors on this complement protein, neutrophil can bind to this as three mechanism, and antigen antibody complex, complement proteins, then neutrophils will bind, or they may go and bind without the complement proteins directly to antigen antibody complex, or they may bind to only this. This step will give more C3b, more C5a in the system. They may also go and bind to the endothelial cells. So you have three repertoire, three different types of complexes given scenario, and all have been utilized by neutrophils only. So neutrophils will come and attach. Basically, they are the one causing an inflammatory response, killing these tissues. They cause the inflammation through reactive oxygen species granules. That's what he is explaining here.
Type 3 hypersensitivity reactions can be either localized or systemic. Localized type 3 hypersensitivity reactions may be called Arthus reactions, especially if the skin is involved. Localized reactions may occur when antigens have been either injected, inhaled, or ingested. For instance, An Arthus reaction may occur in certain individuals after receiving a tetanus or diphtheria vaccination. The injected foreign proteins of the vaccine bind to antibodies, forming immune complexes at the site, resulting in inflammation and induration. Certain inhaled antigens can cause a localized type 3 hypersensitivity reaction in the alveoli of the lungs. Examples include farmer's lung and pigeon breeder disease. Ingested substance, like gluten, can cause celiac disease or gluten-sensitive enteropathy in susceptible individuals. Forms of systemic type 3 hypersensitivity reactions.
So in this case, he is talking about a condition of two types of hypersensitivity reaction based on the tissue or localization or locality involved in the body. It's called localized, means it's particular located to only specific portion of a body, either skin, lung or kidney. But if you talk about systemic, means its whole body will be affected. That is the fundamental difference. You are seeing that Arthur's reactions are nothing but they are coming from vaccination. You are inducing you are trying to provide a booster dose or initial dose of the vaccine to a specific disease. The body can respond to it. It may have an adverse reaction. So it's basically done through hypersensitivity, type 3 hypersensitivity reaction. Another disease condition or another entry points they have discussed here. Let's see what is systemic about. Arthur's reaction is localized on the skin. Systemic, one example is called a serum reaction, or we'll see that serum reaction is nothing but you provide an external antibodies or antivenoms through antivenom or antitoxins, the body will respond. We'll see that.
Include serum sickness and a certain type of Raynaud phenomenon, where cold temperatures cause immune complexes called cryoglobulins to precipitate in circulation and block blood flow in tiny capillaries of the nose, toes, and fingers. This blockage leads to pallor, numbness, and eventual cyanosis. Systemic type 3 hypersensitivity reactions can also be seen in autoimmune diseases like lupus, where large numbers of immune complexes attach to the endothelium of blood vessel walls, causing vasculitis, and can lodge especially in the glomerular capillaries of the kidneys, causing acute glomerulonephritis. In another autoimmune disease, rheumatoid arthritis, immune complexes known as rheumatoid factor, or RF, composed of IgM, IgG, and complement, is deposited in joints and elicits an immune response that causes joint damage and destruction.
So basically he is talking about systemic response here. He is talking about serum sickness, basically saying that the body encounters a sickness or disease basically coming from a serum. Serum is nothing but we have seen that serum antibodies. Antibodies are usually called serum antibodies because they are present in the sera only. Then you raise one serum to one animal to another animal, rabbit to horse, horse to rabbit, vice versa. Then from serum you are extracting anti-sera. Anti-sera also will contain antibodies. So those antibodies are the one that helps us to make monoclonal and polyclonal antibodies that will help in the vaccination also. But if those serum or anti-sera will cause a sickness, then it is nothing but type 3 hypersensitivity. And they are talking about in this section a lot of autoimmune diseases. Why I'm emphasizing this one, I thought I will discuss in the next class. But if you look into this, systemic lupus erythematosus, SLE, or rheumatoid arthritis, these are the classical examples of autoimmune diseases. This is nothing but chapter 5. The chapter 5 talks about only these things. Then if you really work hard or well enough for hypersensitivity, this lecture and yesterday's lecture, I think most of the immunology you can cover. Autoimmune diseases, it will cover in the next unit 5. This is important for unit 5. So that's what, we will stop the video here. And then that's what he is discussing about in terms of type 3 hypersensitivity. Then we will come back on type 4. We'll go back to the lecture and try to come back what we have discussed so far. Okay, that's the video is saying that there are endothelial cells, lining of endothelial cells, type 3 immunocomplexes, they will go and deposit themselves there. In terms of blood vessel you are seeking here, And if you look in the typical cell morphology of the blood cell, it will consist of the basement membrane that is coated in the blue here, and then the endothelial cell immediately residing below the basement membrane. These are the ones, because you are looking at a blood vessel here. It's a cross section of the blood vessel. If you look in that, it's a tube, long tube. Then you turn this cross section as a linear, you see as a tube. These immune complexes are just flowing through the tube, flowing to the blood tube. And some of these complexes, they have the potency or tendency to attach to the endothelial cells, stop flowing into the circulatory system. Once they attach themselves, it triggers a kind of immune response, suggesting that complement should come here. There seems to be some aberrant activity happening here. C1 will come. Basically, it complement cascade will come, and it goes into a kind of response that alleviates or it exaggerates, giving a lot of molecules from here and a lot of crosstalk with different neutrophils. That FCR here, FCR receptor on the neutrophil, they will release lysozyme enzymes. Further chemotaxis, inflammation happens. Eventually, the tissue is damaged. That is the cause of type 3. You look into the situation here, you read the text here, it explains again the mechanism discussed here. As it discusses again antibodies only, it is a response of complement system is involved. Antigen antibody complement as a complex. So we discussed about serum sickness. I will show a few examples for Arthur, serum sickness, and then the descriptive lecture. You read on the text on your free time. Serum sickness is a reaction that is similar to an allergy. The immune system reacts to medicines that contain proteins used to treat immune conditions, and it causes an adverse reaction to a medicine or anti-serum, causing a kind of this kind of symptoms, this kind of redness or pruritus or itching, whatever we have discussed in previous class. And typical serum sickness onset commonly takes 1 to 2 weeks, rarely 1 month. It resolves within a few weeks of drug cessation. For example, what is the component that causing or triggering this? The drug cannot stay longer in the body. It goes through in kinetics of the drug. It will be disintegrated. Eventually, metabolism will happen. Drug will be metabolized. Once the components of the drug will disappear from the body, this adverse reaction will also disappear because no complexes will be deposited. Clinical condition, you go look into that. In terms of diagnosis or investigation, you look into a situation that reduced C3, C4 episodes, reduced neutrophils, and some of this eosinophilia or elevated condition that you can diagnose this condition. So same way, I have given more text. You can go into read a little bit more about it. Basically, the serum sickness can come for antivenom or antitoxin containing animal proteins or serum, or antibiotics, antitoxin example, or in a case of hepatitis B virus also it can come. And the Arthur's reaction, another thing we discussed, it is discovered by Maurice Arthur, scientist. It acute inflammatory response. They observed that when the rabbit skin, they induced a kind of specific horse serum into the rabbit, animal different, rabbit and horse. They induced a horse serum into a response to see what happens to the skin. They already sensitized the rabbit previously. Second dose or booster dose they have given, they have suddenly seen that adverse reaction happened, and based on that they called Arthur's reaction. When they looked into more detail, it is the immune complex reaction, and type 3 is the working mechanism there. So a typical example of Arthur's reaction, the reddish swelling or erythema will look bigger, enlarged. The region of the skin also will be not small spots, it becomes spots. The mechanism is nothing but whatever we have explained so far. So this is a typical condition of Arthur's reaction. Going to that, you're looking into vaccination. Typically, tetanus, diphtheria, vaccination sometimes cause or typically causes immunization, Arthur's reaction. Treatment oral given, clinical findings, you can wait, then the reaction can succeed. Or otherwise, prevention. Arthur's reaction to tetanus, you can vaccine, you can see that. Always observe a 10-year interval between one tetanus to another booster dose. 10-year difference they are saying. If a Arthur's reaction to diphtheria vaccine, you may use that. You may alternate the vaccine with the composition of use of tetanus toxoid rather than Tdap vaccine. Component if you change, you may can succeed the reaction happening here. Why I'm talking this again here? Because this will be the last unit, vaccination. We might come across again, we might be speaking about hypersensitivity again in that situation. or we might be speaking about antigen antibody complex. So basically this two lecture, this unit is very critical. It's actually unit 4 between unit 7 and unit 1 in the middle, and it is cost a lot of marks for you in terms of fundamental understanding. Also, if you understand hypersensitivity, whole immunology will be to your fingertips. Okay, so let's take a 1 minute break and slowly go into that, look into the mechanism here. I don't want to rush into again next cells. We will be going into now shifting the gaze from B cells to T cells, from humoral to cell mediated. So the concepts in the next 10-15 minutes will be different, but glance it one more time, take a 10-minute break, 10 seconds break, not minute. Then we will come back on T cell mediated. Let's look into the mechanism here, what happens. Then in 10 seconds, I will go back to T cell mediated. Okay, 8, 9, 10. Let's go. Let's go to B cell to T cells. Now we are jumping the gaze in terms of type 4 hypersensitivity reaction. Now we won't be talking much about the B cells. We'll be talking about T cells. Type 4 is mediated by acquired immunity in terms of cell mediated response. T cells are involved. A T cell mediated delayed hypersensitivity reaction. It is called delayed because the response takes 48 to 72 hours and it is mediated by T cells involved in contact dermatitis and type 4 drug reactions. It is involved in a specific disease condition called contact dermatitis, or you can simply say touch and T cell and touch, or type 4 drug reaction. The drug may be TB drug, or we'll see that there is some kind of T linked to that, mnemonic, ampicillin rash, or some other epidermal necrolysis. So when you look into the mechanism, that's talking about a T cells in this hypersensitivity reaction. When it comes to T cells, you have already been studying in the several classes, MHC, HLA typing, and antigen antibody recognition, that T cells will be of two types. They have a specific markers on their cells. The marker may be CD4 positive T cell or CD8 positive T cell. So if this T cell is involved in this hypersensitivity reaction, the mechanism is different. If this T cell is involved in that, the mechanism is different. That is that. If you know the difference between these, which is the molecule they are interacting, everything will be easy for you. So in terms of if T cell, that CD4 positive antigen presenting cells, we will see that. I will see this, then it will be easy. When the T cell is CD4 positive, it is antigen presenting cells are involved. If T cell is CD8 positive, it is direct on somatic cell. It is cell mediated cytotoxicity. When antigen presenting cells are there, it is an inflammation by cytokine. So what I'm talking here, it may confuse you, but you look into this important box here that makes everyone's life very easy. So I'm talking about two types of T cells. One is T cytotoxic, one is T helper cell. And I'm going into a simple mnemonic we discussed, 8 ones are 8, 4 twos are 8. Both multiplications will give 8 in the outcome. But if you look in 8 ones are 8, you're looking at CD8 positive cells here, and the one represent MHC class 1. So the CD8 positive T cells are MHC class 1 associated always, 8 ones are 8. And then if you think of class 1, we have been discussing that they are present on the top of the all nucleated cells. So T cells are 8 ones are 8, CD8 positive T cytotoxic cells associated with MHC class 1, all nucleated cells. Okay, that's a typical condition of CD8 positive T cells, T cytotoxic cells. And come back to T helper cells. They are CD4 positive. We're talking CD4 positive, 4 twos are 8. If it is 4, then it is associated with MHC class 2 only. Okay, 4 and 2, CD4 positive. It is associated with MHC class 2. And you are seeing MHC, it is major histocompatibility complex, but you look into the H as a mnemonic, T helper cells, they have H, so they will come with the MHC class 2 molecule. Nothing but these MHC class 2 are antigen presenting cell, antigen helper cells. These cells are always associated with T helper cell. Without these antigen presenting cells, T helper cells will not work, and then this association helps them to see 4 to the 8 MHC class 2 molecule. Class 1 is present in all nucleated cells. Class 2 is present in only antigen helping cell or antigen presenting cell. They are associated with T helper cell. So if you make this very nicely, you remember this, because it always confuses T cytotoxic or T helper, MHC2 or 1, where is antigen presenting cell coming? You look into the help here, T helper, help wherever is there. Antigen presenting cells are helping here. So they are associated with T helper cells only. The T helper cells, you go into 428 CD4 positive. That's what we discussed, right? The MHC CD4 positive, it's a T helper cell, T cytotoxic cell, CD8. Associated is molecule MHC2 molecule, 428 APCs are A antigen helping cells, and CD8 all nucleated cells, 818 here. And fundamentally, one more difference from B cells to T cells is that T cells will always come with T cell receptor. T cell receptor will be always be associated along with this CD4 marker that we already discussed, basically saying that different cellular markers in terms of ligand and receptors attached to the membrane. These are the antibodies, IgM and IgB. This is T cell receptor coming from the plasma membrane. MSC molecule class 1 and class 2, they structures. Basically, it's important in cell-to-cell signaling. If you look, whenever you are talking about T cell or T helper cell, T cytotoxic cells, you need a complex, ternary complex. That complex is blue is helper cell, T cell, and this is the antigen presenting cell. They communicate with each other, a class 2 MSC molecule here, and T cell receptor here. This is the peptide, nothing but antigen. And to communicate properly, these two communication may not be enough. They need one more third communication, third attachment, that is CD4 molecule. If all these three connections are proper, then only the signal transduction happens, the immune response will happen. Basically saying that the epitopes recognized by T cells are internal. They need a processing step where antigens are processed by antigen presenting cell through MSC2 molecules. The processed antigens attached to MHC2 molecules, then only they will be represented to T cell receptors. This complex is important. Along with that, they need a CD4 positive mechanism to work in a proper way. So remember these steps, look into that. What are we talking, CD4 or CD8, T helper cell, T cytotoxic cell, and then what is the connection coming in terms of the MHC molecule, and how they are binding in terms of a complex. Then basically it gives an easy explanation for the coming up video. We have 7 minutes, the video is 6 minutes. We will see how we can control the timing now. Okay. We are going into type 4.
Let's discuss the mechanisms of a type 4 hypersensitivity reaction. In watching the previous videos discussing types 1, 2, and 3 hypersensitivity, you may have noticed that all three of these types involved antibodies. For this reason, they are classified as humoral-mediated responses. In contrast, a type 4 hypersensitivity reaction does not involve antibodies and is therefore not a humoral-mediated response. It is a T-cell-mediated response. This is because a type 4 hypersensitivity reaction involves T helper cells and/or cytotoxic T cells. To visualize the case of the T helper cells, let's assume for a moment you're out camping. It's nighttime and the campfire's out, and you're sleeping in your tent when you hear a strange rustling noise outside. You're brave, so you grab a flashlight and go out to investigate. It's dark. You follow the noise out away from your tent and land the light on a squirrel. It dashes off as you grumble quietly to yourself. You start making your way back to your tent, but realize you've walked right into a patch of poison ivy. Everyone knows poison ivy causes a rash or reaction in the skin. Please realize this is a type 4 hypersensitivity reaction. Poison ivy contains a compound known as urushiol, which binds with proteins in the skin and alters the proteins. The immune system now recognizes these changed proteins as foreign. These immunogens are recognized and processed by an antigen-presenting cell, or APC, and presented to a naive T helper cell. The APC will present a portion of the protein using an MHC class II receptor, which T helper cells are able to recognize and bind to. After binding of the APC to the T helper cell, the APC will release cytokines that cause the naive T helper cell to differentiate. If the APC releases certain cytokines, including IL-12, then the naive T helper cell will differentiate into a type 1 T helper cell, known as a Th1 cell. The Th1 cell will then release several cytokines, including IFN gamma, which activates macrophages. The activated macrophages will release IL-1.
So see that one more important step here, a foreign antigen through this poison ivy is coming. They are come through a skin proteins or they need processing by antigen presenting cell. Because when the T helper cell is involved, MHC class 2 is involved, they need APC, they cannot bind directly to the antigens. These antigens need to be processed by antigen presenting cell. While the processing, they will represent the class 2 here. And then specifically interleukin, one more molecule they will release. These are the molecule extension of chapter 2 we will read. And then basically the naive T helper cell, it doesn't know what to do initially. The T helper cell is there, but it will become specific to urushiol based on the recognition here. The complex will make, it makes specific from naive, it becomes a specific T cell. That is that it is transformed, it is memorized into a T helper cell 1. This is called T helper cell 1 later. From T naive cell will become exposure attachment to this antigen, T helper cell 1. Once it becomes T helper cell, it knows how do you go and destroy this. It will talk to macrophages.
And TNF alpha, which cause expression of receptors on endothelial cells to recruit more leukocytes to the area. Activated macrophages perform phagocytosis and release reactive oxygen species and toxic lysosomal enzymes that cause the tissue damage that manifests itself after exposure to poison ivy. The APC may also release IL-6 and other cytokines that cause naive T helper cells to differentiate into a subtype of T helper cells known as Th17. A Th17 cell will then release.
So basically this is again one more crosstalk. So this all we will take in the next class when we will talk about interleukins. So let's remember just naive cell will become Th1. Th1 will have one more mechanism in terms of releasing IFN gamma that induces macrophages to go into lysosomal enzymes or react to oxygen species. That we will see into that. And given 2 minutes time, I think you can go into the video. There is T cytotoxic mechanism also that you go in free time, or when we take interleukins, we will open this, read it one more time. So just go back, review the 2 minutes, the lecture. That will help us quickly. Then we might have to do one more class for it. So no need of that. So watch the video. The same thing they are talking is nothing but when a CD4 T helper cell is involved, MHC2 molecules will come, macrophage will elicit a response through reactive oxygen species, or eosinophil will come up, lysosomal enzymes will come up. Look into the text, make a notes. This is, we are talking about CD4 T helper cell. When you move up into the gates in terms of CD8 T helper cell, cytotoxic cells. When you talk cytotoxic cells, you're not talking about antigen presenting cells at all. You're talking about MHC class 1 molecule. They bind with CD8, a ternary complex will form. Basically, they will help in virus infected cells. They will go with intrinsic, extrinsic, and cytokine release. Intrinsic will cause a granzyme and perforin reaction. And alternately, they may cause apoptosis, cell death to specific FAS, FAL. This is the ligand. FAS is the receptor that will induce a apoptotic signal, or direct cytokines, IFN, TNFN, or leukotrienes. This we will talk in the second part of the class, unit 4. Just go to the video and look into that mechanism again one more time. You read it. Basically, T cell mediated, it involves CD4, CD8. If CD4 is involved, MHC molecules are involved. They cause allergy through contact dermatitis. It looks like that. You look into that. Basically, 4 T's are associated with T cell transplant rejection, TB at touching, contact dermatitis. We will take up again when you talk interleukins, interferons. We'll look into the video one more time. But given the scenario, type 4 is fourth and last, delayed. Okay.